Whether you're young or already in your prime years, your penis isn't just one organ, it's actually a muscle complex that needs regular training. Just like your biceps or your calves, the erectile tissue in your penis loses elasticity over the years if it's not being used. The result? Weaker erections, less stamina, and a serious hit to your confidence in the bedroom. But here's the good news, folks. With targeted exercises, you can stop this process and even reverse it. Welcome back to my channel. I'm Dr. Hannah McLeod, a urologist and men's health specialist with over 30 years of experience right here in Canada. Today, I'm going to show you step by step a scientifically backed approach to training your penis. Yes, actually training it like you train at the gym, so the tissue stays healthy, well circulated, and performing at its best. Now, to understand why this works, let me give you a quick medical overview. The erectile chambers in your penis are made up of smooth muscle cells and blood vessels that are controlled by androgens like testosterone. When these chambers are regularly filled with oxygen-rich blood, the tissue stays elastic and resilient. But when that doesn't happen often enough, connective tissue starts to build up, elasticity decreases, and erectile problems become more common. Studies show that men over 60 who actively train their erectile tissue have significantly fewer issues with erectile dysfunction. Hey, if you're finding this video helpful, please write a 1 in the comments below. If you think something's missing, leave a 2 so I can improve the content for future videos. And if you're new here, don't forget to subscribe to my channel for more tips on men's health after 60. Thanks for that, folks. So what are we waiting for? Let's get started. First, let me explain the science behind why your penis needs training just like any other muscle. We need to look at the biological mechanism of an erection. It all starts with testosterone, the most important male hormone. It doesn't just determine masculine traits like a deeper voice or strong muscles. It directly influences your libido, your energy levels, and your ability to get erections. Testosterone peaks in your early 20s. From about age 30, it drops by roughly 1% per year. For men over 60, this decline is particularly noticeable. Factors like lack of sleep, being overweight, smoking, excessive alcohol consumption, or chronic conditions like diabetes, high blood pressure, and cholesterol problems speed up this process significantly. But how does testosterone connect to the erectile chambers of your penis? These two cylindrical tissues are made up of tiny hollow spaces that fill with blood during sexual arousal. On the surface of these hollow spaces are numerous androgen receptors. You could think of them as locks, while testosterone is the key. When the key fits, biochemical signals trigger the smooth muscle to relax, nitric oxide gets released, blood flows in, and the veins get compressed. That's how you get a stable erection. However, when men don't have much sexual activity, or when age and illness lower testosterone levels, the structure of this tissue changes. The smooth muscle gradually gets replaced by collagen. We call this fibrosis. The more fibrosis develops, the less elastic the tissue becomes. Blood can't be retained effectively anymore and escapes too quickly. We doctors call this a venous leak. The result? Your penis doesn't get properly hard, or you lose the erection too soon. In my practice here in Toronto, I've treated many men over 65 who told me everything used to work fine, but now I lose my erection after just a short time. During examination, it wasn't just that their hormone levels were low. More importantly, their erectile tissue had lost its elasticity simply because it hadn't been trained enough. This confirms the well-known medical principle: use it or lose it. What isn't used gets lost. In other words, your penis needs regular activity through intercourse, healthy masturbation, or specific medical exercises. This isn't just about sexuality. It's about quality of life and overall men's health as you age, right? Now let me talk about the training solution. Getting your penis to the gym, so to speak. How can you specifically train your penis in a safe, scientifically sound way? Besides regular sexual activity, there's a proven tool called the Medical Vacuum Erection Device, or VED for short. In everyday language, folks often call it a penis pump. Here's how it works. The VED consists of a transparent cylinder that seals airtight at the base of the penis and connects to a hand or electric pump. Through negative pressure, arterial blood is drawn into the erectile chambers, filling your penis completely. Important point, this isn't causing injury. It's like a training session for the tissue. The effect? Oxygen-rich blood reaches the erectile chambers, the hollow spaces get stretched, and the tissue stays elastic and resilient. Now, let me be specific about which devices I recommend, because I know this is a question many of you have. In Canada, you can find medical-grade VED devices at most pharmacies or through medical supply companies. Brands like Postivac, Encore, and Augusta are Health Canada approved and range from about $80 to $200. Some provincial health plans might even cover part of the cost if prescribed by your doctor. You can also order online, but make sure it's medical grade. Avoid the cheap novelty items, eh? For safe application, here's what you need to know. First, preparation. Trim your pubic hair. Apply some water-based lubricant to the cylinder rim to create an airtight and comfortable seal. For application, insert your penis into the cylinder, press the base firmly against your body, and pump slowly. The goal is a firm but comfortable erection. No pain, no bruising. For duration, maintain the pressure for 30 to 60 seconds, then release and pause. Do several cycles back to back, totaling about 10 minutes per session. For frequency, 3 to 5 times per week is ideal. Daily short sessions are also possible, but never longer than 10 minutes per session and no more than twice a day. Here are some important warnings, folks. Many men think more is better, but the opposite is true. Overtraining causes harm. The smooth muscle and blood vessels in your penis aren't like skeletal muscles. They need gentle training. Too much pressure leads to bruising, swelling, or vascular damage. Let me share a case study. I had a 68-year-old patient from Vancouver with diabetes and high blood pressure who'd been suffering from erectile dysfunction for years. After 3 months of doing VED sessions 4 times a week plus daily walks, he told me enthusiastically, "I haven't just regained my confidence, my erections are significantly more stable again." This shows that when used correctly, the VED isn't just a gimmick, it's real therapeutic training. Now here are 2 more precautions. If recommended by your doctor, you can use a constriction ring after VED application to prolong the erection during intercourse, but never wear it for more than 30 minutes, and definitely not while sleeping. Men who take blood thinners or suffer from Peyronie's disease need to discuss the application with their urologist first. For sure, safety comes first, but the VED is just the first trick. Let me give you 3 more essential strategies that work together with your VED training. Trick number 2, pelvic floor exercises, specifically Kegels for men. Your pelvic floor muscles support erectile function and ejaculatory control. Here's how to do them. First, identify the muscle by stopping your urine midstream. That's your pelvic floor. Then, several times a day, contract that muscle for 5 seconds, release for 5 seconds, and repeat 10 to 15 times. You can do this anywhere, sitting at your desk, watching hockey, driving your car. After a few weeks, you'll notice stronger, firmer erections and better control. Studies from McGill University show men who do regular Kegel exercises see up to a 40% improvement in erectile quality. Trick number 3, eat for your blood vessels. The right nutrition is like fertilizer for your vascular system. Leafy greens, beets, and pomegranates provide valuable nitrates that dilate blood vessels and boost blood circulation. Watermelon contains L-citrulline, which demonstrably improves erection hardness and supports blood flow. At the same time, you should drastically reduce sugar-fried foods and processed meats. They promote inflammation, weight gain, and vascular damage. Think of the Mediterranean diet, folks. Lots of fish, olive oil, vegetables, and whole grains. It's not just good for your heart, it's great for your bedroom performance too. Trick number 4, optimize your sleep and manage stress. Without adequate sleep, testosterone levels drop. Ideally, you want 7 to 8 hours per night. A German study shows men over 60 who sleep well have up to 20% more testosterone. Chronic stress drives up cortisol, a hormone that blocks testosterone. Relaxation through meditation, breathing exercises, or walks in nature is essential. Here in Canada, we're blessed with beautiful parks and trails. Get out there and give your mind a break, eh? Establish evening rituals for better sleep. Dim the lights, avoid screens an hour before bed. Maybe read a book or listen to some Gordon Lightfoot. Now, let me address some special cases because I know many of you are dealing with specific health conditions. If you've had prostate surgery, you might be wondering about testosterone and erectile function. Here's the truth. Prostate surgery, especially radical prostatectomy, can affect the nerves responsible for erections, but it doesn't directly remove testosterone production. That happens in your testicles, not your prostate. However, recovery can be challenging. VED therapy is actually one of the recommended rehabilitation tools after prostate surgery. Many urologists, including myself, prescribe daily VED use starting a few weeks after surgery to prevent tissue shrinkage and maintain blood flow. Combined with patients and sometimes medication like Cialis or Viagra, most men can regain some level of function. But talk to your surgeon first, right? For those of you with diabetes, you face extra challenges because high blood sugar damages the small blood vessels and nerves essential for erections. But here's the encouraging part. If you manage your blood sugar well, exercise regularly, and use VED training, you can still maintain good erectile function. I've seen it work for countless patients here in Calgary, Winnipeg, and across the country. The key is consistency and not giving up just because you have diabetes. If you're on blood thinners like warfarin or newer anticoagulants, you need to be extra careful with VED devices because you're at higher risk for bruising. Use lower pressure, shorter sessions, and watch closely for any signs of bleeding or bruising. Always discuss this with your doctor before starting. Now let's talk about lifestyle as the foundation for potency. VED training is a powerful tool, but it's not enough on its own. To truly maintain your potency after 60, you need a holistic lifestyle that strengthens body and mind equally and provides long-term protection. Movement and exercise keep your blood vessels fit. Just 30 minutes of walking daily improves blood circulation in the pelvic area and promotes nitric oxide production. If you add 2 to 3 strength training sessions per week, squats, push-ups, or light dumbbell work, you'll boost your testosterone levels naturally. A Harvard University study proves that men who exercise regularly have a 41% lower risk of developing erectile dysfunction and benefit from more energy in daily life overall. But it's not just about exercise, folks. You need to quit unhealthy habits. Even 1 cigarette a day demonstrably reduces blood flow to the penis. Excessive alcohol damages your liver and lowers testosterone. Conditions like diabetes or high blood pressure must be consistently treated because they're the main causes of vascular damage and worsen potency problems. Here's another case study for you. A 72-year-old patient from Halifax came to me saying, "I'm not a real man anymore." After 4 months of VED training, daily walks, more vegetables in his diet, quitting smoking, and better sleep, he stood before me 6 kilograms lighter, with more stable blood pressure readings and significantly improved erectile function. His conclusion? "I feel 10 years younger and full of joy for life." So let me summarize everything for you one more time. Your penis is like a muscle. If you don't use it and train it regularly, it loses strength and elasticity. But with the right knowledge, targeted use of a medical vacuum device, pelvic floor exercises, proper nutrition, good sleep, and a healthy lifestyle, you can actively counteract this process. You'll preserve not just your erectile function, but also your joy for life, self-confidence, and intimacy in your relationship, well beyond your 60th year. From my experience as a urologist practicing right here in Canada for over 3 decades, I can assure you it's never too late to start. Men who make small but consistent changes report not just better erections, but also more energy, more stable moods, and significantly higher quality of life overall. Listen, if you found this video helpful, please write a 1 in the comments below. If you think something's still missing, leave a 2 so I can make the content even better for you. And if you're new here, subscribe to my channel, Dr. Hannah McLeod Men's Health, so you don't miss any more tips on potency, hormone health, and quality of life as you age. Thanks so much for watching, folks. Stay healthy, stay strong, and stay confident. I'll see you in the next video. Take care now, eh?